Hello, and welcome back to our third video in our antimicrobials lecture series. And here we kind of wrap up, finish up, and tie all of our bowstrings up. So we have a drug. Okay, we have all of our list of drugs that the doctor can choose from. Now you are sick. What do you do? Okay, so if you're the doctor, you'll probably prescribe a broad spectrum antibiotic. If they have if they have a bacterial infection, they have a viral infection, you send them home with some ibuprofen. Okay. Now, for the ones that gets the ID doctor called, the infectious disease doctor called, you're going in there with the big gaping old wound, an abscess. You got a lot of things going on with you, okay? Then you're going to get admitted, and that'll be different, okay? But if you just go and you say, I have strep or something, they'll do a test for you. But let's say that broad spectrum doesn't work, and you come back, and you're like, oh, what do I do? Well, then they might do the Kirby-Bauer test that we did, okay? And if you have a Pseudomonas infection, like on the left, well, all the way over there, and you have a regular bacterial infection, maybe not regular, but an E. coli infection or a B. cereus infection over here, you can see the difference, okay? That if you had a Pseudomonas infection, you have much less to choose from that will actually treat you than if you had this disease, okay? So right away we can tell the difference between our Pseudomonas infection and our normal infection. In addition to the green color, if you ever see green and blue or greenish blue, it's almost always that Pseudomonas infection. Okay, and so with these two pictures, I can say, okay, well, this guy right here, this is, and I would measure it to make sure with my ruler, but I can say tetracycline is resistant to, or this bacteria is highly susceptible to tetracycline. Okay, this bacteria is highly susceptible to vancomycin. Okay, this bacteria is resistant to streptomycin. Okay, so you can kind of see how we talk about the drugs here. Okay, the Pseudomonas is resistant to vancomycin. Pseudomonas is resistant to penicillin. Most likely, Pseudomonas is resistant to kanamycin, even though it has that some kind of banding. I would measure it. It's probably not intermediate, and it's also probably intermediate to erythromycin. Okay, that one actually does have some kind of clear zone that I would measure and make sure. All right, so that is how we would determine which drug to use. Okay, we wouldn't use this one, we wouldn't use this one, and we wouldn't use this one. We probably wouldn't use this one either. Okay, and then this is a good one, this is a good one, and this is a good one. All right. So now how much do you give? Okay, we had a guessing game here. We can also culture it at the same time we made this plate. We can culture it in a minimum inhibitory concentration. Okay, so if I give that same drug only 2 micrograms per milliliter, the bacteria does just fine. So it might be lethal to it, but it can grow despite it. Okay, it's just not enough to keep killing it faster than they replicate. Same with 4. Okay, and then we put it up to 8, and 8 shows us, hey, it doesn't like 8, you can prescribe 8. You could even go in further and maybe find out that 5 is the right amount or 7 is the right amount, but for now, you've done 2 tests, you've gotten the right amount that you'd want to give to the individual, and you have the right drug. Okay, and this is all very, very important because we don't want to start resistance. Okay, how do we get resistance? Well, not everything is resistant to things, as we saw in our Kirby-Bauer picture. Okay, but let's say we were prescribing the wrong drug, and we prescribed a broad spectrum drug, and it took out everything except the pathogen that we want to keep, that we want to get rid of, rather. Okay? So it kills everything except the one we want to get rid of. Now they're all gone, but the food's still there, the water's still there, the body is still there. So we are going to take advantage of that and grow, 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 grow. And we have no more competition. In fact, this is how we prevent infections on ourselves, is we grow the good bacteria and they help us by keeping the bad ones out. But if we kill them all, they will make a super infection. All right, so that is bad. We don't want that to happen. We use the minimum amount we can, we use the drug we can, and we time our antibiotics correctly. If it says take it for 10 days, you take it for 10 days. You don't want this to happen, okay? Don't say, hey, I'll take it next time and make my cold go away next time faster because it went away overnight. What happened is you probably killed some of it, so it stopped colonizing you, but then it's just going to grow again because you didn't kill all of it yet. Okay, so don't save your antibiotics. All right, and I've made quite a bit of fuss over this next slide. Okay, it's kind of big, it's kind of daunting, but we kind of see that all of the stuff we need to take into consideration when we actually prescribe something. Okay, we need to know the actual infection. Is it throughout the whole body? Is it localized? Okay, what drugs can we take? We're going to give a broad spectrum drug most likely if we're at a family medicine place and you just come in and you're otherwise healthy. Okay, but other than that, we kind of get into it and we kind of need to discover what you have. Are you allergic to anything? You probably hear it all the time. Are you allergic to any medication? Are you allergic to any antibiotics? Okay, we need to know that. You need to know how much to give based on their weight and age and all that kind of stuff. Are they pregnant and breastfeeding? Right? Can't give them stuff then either. Drug interactions. Have they ever had any other kind of things before? Did your Kirby Bauer turn out all right or unexpected? Okay, or did you get prescribed this antibiotic in your last 5 times and your chart sees it and they're like, oh, this probably won't work. Okay, and do you have insurance? And finally, can the patient even take it by themselves, right? So do they need to be admitted? Do they need to have home help? Lots of things go into how a drug can be prescribed. Not everybody has an IV for fluids even. Okay, this is the last 2 slides. They are kind of content heavy, but as the stamp says, you do need to know these. Okay, these are the drugs of choice for practicing medicine today. Okay, so penicillin, no-brainer, earliest one discovered, probably never prescribed anymore, but it's a beta-lactam. Okay, the beta-lactams affect the cell wall. That's the most important part of it, not that it's penicillin. Vancomycin, okay, is used to treat usually the bad stuff. Okay, if you have a very bad infection, we're going to treat it with vancomycin. Vancomycin is losing its potency. I've seen some videos on that, but that's neither here nor there. Potency by creating superbugs, not in its mode of action. Clovenolate, not an antibiotic itself, but works with penicillin class. Okay, it inhibits beta-lactamases, which would degrade our beta-lactams. Okay, acyclovir. Acyclovir is an antiviral drug to treat herpes. Okay, metronidazole, an antibiotic and antiprotozoal medicine. Okay, and antifungal azoles. Okay, like fluconazole, ketoconazole, mycoconazole, are going to inhibit the synthesis of ergosterol, a component of the fungal cell membrane. Tamiflu is another VIR drug, antiviral. Antiretroviral therapies are kind of called CART, combined antiretroviral therapy, or just ART sometimes for antiretroviral therapy. And those are very important in managing HIV and how we can actually have HIV for years and years without dying. And then we even have pre-exposure prophylaxis called PrEP, which I alluded to earlier. Okay, so pre-exposure prophylaxis PrEP. Um, so yeah, these are ones you'd want to know going forward. All right, and that is the end of our antimicrobials lectures. I hope you enjoyed them, and stay tuned for the next ones.